Which color is your tongue? What is healthy and what isn't? When the muscular organ that allows us to speak, taste, and swallow is healthy, it takes on a specific appearance. If the eyes are the windows to the soul, the tongue might be thought of as the body's check engine light. Doctors can tell a lot about your health based on how your tongue looks, and its color is a good indicator. What should your tongue appear like? The tongue should be rounded and symmetrical. It is often pale pink, but in African, Asian, and Mediterranean people, it may contain a hint of purple or brown. It may also have a light white coating. Dr. Tian Zhang, a prosthodontist in the Department of Oral Health Policy and Epidemiology at Harvard School of Dental Medicine, explains that the covering is made of a tough protein called keratin, which helps keep your tongue from getting scratched while you eat. If you look closely, you may notice that your tongue is covered in tiny bumps called papillae that have multiple functions. They have tactile and thermal senses. They have taste buds that allow you to identify whether food is savory, sweet, salty, sour, or bitter. To assist you in forming a little ball of food or bolus that you may swallow, they create friction. Can tongue color be affected by diet? Sure. A change from your typical tongue tone can occasionally be partially attributed to your diet. The reason for this is that the papillae have the ability to absorb food and drink colors and residues. For instance, the blue popsicle or sweets you had as a child most likely gave your tongue a vibrant hue of blue. Other meals and beverages that can leave their imprints include tea, coffee, and curries that include a lot of yellow turmeric. However, discoloration is typically very transient. Food particles and colors that stick to the tongue can be removed by drinking lots of water and practicing good dental care. White patches, a tongue that is bright or dark, and other concerning symptoms. Certain tongue appearances and color indicate health problems. If you have any of the following symptoms, consult your doctor. 1. Black or brown tongue is indicative of a disease known as black hairy tongue. When papillae become too long, this happens. Because they are constantly falling out due to all the action in your mouth, these little bumps typically don't have much of an opportunity to grow. If they do develop, the brown or black tint may result from the bacteria they collect and a combination of food colors. Using antihistamines or antibiotics, smoking, having dry mouth, consuming a lot of coffee or black tea, or having poor dental care are risk factors. 2. If you have thick white spots or white sores on your tongue, you most likely have thrush, an overabundance of yeast in the mouth. Conditions like diabetes or HIV, adverse reactions to antibiotics or cancer treatments, wearing dentures, smoking, dry mouth, or using steroid inhalers can all cause thrush. White patches or lesions may occasionally be signs of oral cancer. 3. Painful red or yellow sores on your tongue could be an indication of oral cancer, which is rare. Thrush, often presenting as red patches or canker sores, which are inflammations of the tissues. 4. A bright red tongue may be a sign of vitamin B12 insufficiency or scarlet fever, which is a rash that turns red on the body and is caused by a streptococcus bacterial infection of the throat, often known as strep throat. You may have a benign incurable illness known as geographic tongue if you have bright red patches on your tongue that move around and don't ache. Which is better, using a tongue scraper or brushing your tongue? Brushing and flossing your teeth at least twice a day are essential components of good oral hygiene. Use the brush on your tongue for a few seconds. With your tongue extended, make 3 swipes down the middle, left, and right sides of your tongue with your toothbrush between them. This aids in clearing the papillae of dirt and microorganisms, says Dr. Zhang. Certain individuals swear by cleaning their tongues using a tongue scraper. Although Dr. Zhang dislikes the tool, which is moved forward on the tongue in a manner akin to brushing it, he has no issue with someone using it. There is inconsistent data regarding tongue scraper effectiveness. It all boils down to the everyday efforts you make to maintain the healthiest possible tongue, teeth, mouth, and gums. Brushing and flossing your teeth at least twice a day are essential components of good oral hygiene. Use the brush on your tongue for a few seconds. With your tongue extended, make 3 swipes down the middle, left, and right sides of your tongue with your toothbrush between them. This aids in clearing the papillae of dirt and microorganisms, says Dr. Zhang. Certain individuals swear by cleaning their tongues using a tongue scraper. Although Dr. Zhang dislikes the tool, which is moved forward on the tongue in a manner akin to brushing it, he has no issue with someone using it. There is inconsistent data regarding tongue scraper effectiveness. It all boils down to the everyday efforts you make to maintain the healthiest possible tongue, teeth, mouth, and gums. Are you concerned about your tongue? What actions to take? Should you have any concerns regarding your tongue, contact your primary care physician or dentist. This is especially important if you also have a fever, an extremely sore throat, persistent sores, or any other new symptoms. Your doctor or dentist may examine your condition. Medicated mouthwashes and warm water rinses may be prescribed to alleviate discomfort. It is also recommended to stay hydrated and practice good oral hygiene habits. If required, your doctor may recommend you to a specialist for further assessment. Please don't forget to subscribe to our channel for more healthcare-related content. Like and give your comment. Thank you. WiseWorld Healthcare.